This figure illustrates what has happened with individual market premiums from 2013 through 2026. In 2014, Obamacare's key provisions took effect. So you see a significant increase in premium from 2013 to 2014. In 2014, for this enrollee, so this is for the typical Obamacare enrollee, so a 50-year-old individual who makes 2 times the federal poverty line. That's about the average age and about the average income of the typical Obamacare enrollee. In 2014, much higher premium, but the taxpayer is bearing a significant portion of it because of the design of the subsidies. In 2014, the federal government share was about 68%. The enrollee share was about 32%. The key to understanding Obamacare subsidies is that the subsidy caps the amount that the enrollee has to pay for the plan. So everything above that amount is paid by the taxpayer. So from 2014 to 2020, you have a significant increase in premiums, but the enrollee share stayed flat. Almost all of the premium increase was paid by the taxpayer. So that in 2020, the enrollee share of the premium went down to 20%. The taxpayer share was 80%. In 2021, the Democrats, using reconciliation, passed the American Rescue Plan Act. That contained an expansion of the Obamacare subsidies, these Biden COVID credits. They increased the taxpayer share for every enrollee, and they lifted a cap that existed at 4 times the poverty line. I'm going to get to that latter point on the next slide. The light blue amount is the COVID credit. That is the shift in the burden from the enrollee to the taxpayer. So over the last 5 years, for the typical enrollee, the taxpayer has paid 93% of the premium. At issue is what happens next year. And next year, the COVID credits expire, but the original Obamacare subsidies are still there. And for this typical enrollee, the taxpayer share would be more than 80% of the premium. So a much higher taxpayer share in 2026 than in 2014, the first year of Obamacare.